Squatting. How do we make this? Very, very important function, right?
Yeah, I gotta get to the toilet.
Gotta get to the toilet. Gotta get to that couch.
Car.
But how do we, instead of just regular mini squats, how do we make it multifunctional?
Side kicks. Side kicks. Well, you don't.
I love side kicks because of lateral, right? Subsystem. But just in this motion, what do?
Can we do your wide?
Just in the most simple.
Grab the ball.
Remember, what's life 7?
I don't even go through the
LL. But at the very least, you can have them do a squat, right? You can have them do 5 squats, but then do a butt kick. After every 3 reps, butt kick. So all you got to do is just inject a lean, have them do 5 squats, and then a lean. 5 squats, and a lean. Does that make sense? Just start injecting it. And depending on if they're acute, you may want to only inject 1 lean every 3 or 5 reps. But just start injecting it, and you're going to start seeing faster results. But more importantly, the patient is going to start to feel more happy inside because of your craft. So, but you can also inject leaps. As simple as that. 5, do a leap. Now, if they're acute, maybe the leap is only, 5 reps, and then their leap is going like that. But you want them to feel that vibration. You want them to get that co-contraction. You want to get them modulation, oscillation in their spine. Does that make sense? You want to engage the deep longitudinal synergy system. How else are you going to do it? Pelvic tilt?
No.
Do you understand what I'm saying?
Also really good for neuro patients with sequencing.
It's good for everybody. Everybody. All right, so, and that's just a squat. Now lunging. How about lunging?
Chops.
Is that all you want to do is just have them do lunges?
No, that's boring.
Right? Just jump. Very, very basic thing you can do that will start injecting coordination therapy. What else?
Ab kicks.
Right?
Raise your arm.
Right? Get them through the motion. Start engaging the anterior oblique system, right? Posterior oblique system. Anterior oblique system, posterior oblique system. I'm going to tell you, they're going to feel much different when they walk out of that session at home for the next 4 hours. Then if you just have them doing this. Okay, 20 times, okay, I'm done. Okay, next time, other side, okay. 20 times, okay, I'm done. They're going to feel completely different from that to if you're going to have them do back and forth.
If you engage the vestibular system on it, the vestibular input can last 7 hours.
Right. Right. All right. Everybody stand up. I can see some of you like the food and bread. Now what's nice is you can start to see the difference in sides. So now let's do this. Bring the foot forward. Now let's bring it back. And try to stay balanced. And don't worry if your knee needs to stay bent, that's fine. If you can't go straight out, that's fine. The goal is to eventually go more straight back. If you can't touch your heel, all it is opposite limbs, you guys. Just keep going back and forth and test one side to the other. Test one side to the other versus and see which, some of you will probably notice one side's easier, yeah? Your imbalance, what causes pain? Fault lines. What causes fault lines?
Weakness,
Okay.
imbalance.
Okay, wait a second. Let me clarify this, because you guys are all right. I want you to say the answer that consumers want to hear. We know lack of movement, but if you tell a patient, they say, "So what's causing my pain?" You have fault lines in your body, and the reason why is because you don't move enough. Okay, it's a little insulting. Okay, it's like, how can you tell that? Right? But if you say you have fault lines in the body, and the reason why is weakness, and weakness causes tightness, and tightness causes imbalances, and imbalances causes friction, wear and tear, inflammation, right? Okay? If you say that, and you say it again and again and again, it sticks in your mind. And you begin to actually approach differently. And the patient loves those answers. So, do you have an imbalance?
Yes.
Is there a fault line in you?
Yes.
And what can you do to fix it?
Figure out where that
Movement.
Yeah, weakness.
Movement. Now, do you just randomly do any movement?
No. You have to
Huh? What's your weakness? See, if your weakness is going back here this way, you lose your balance going back. What synergies are off? Posterior obliques. What musculature is off?
Gluteus maximus, latissimus dorsi.
You guys, we've got an exercise physiologist blowing the pants off you clinicians. Okay, come on. But what if this is their problem?
the
Anterior obliques, which is what? Musculature?
So as
The pocket one.
Inferior.
The pocket what? External obliques? Internal obliques? Adductors?
Adductors.
Got it?
External rotation.
So you can actually self-diagnose yourself, your fault line, your imbalance, because if you don't fix it now, what's going to happen?
you're gonna injure yourself.
Gonna get injured.
You're going to get injured. You have vulnerabilities. You're going to sprain, strain. You're going to get injured. You're going to wear and tear, get arthritis. You're not going to be as what? Happy. Does that make sense?
Yes.
I want you to first know how to identify what you need. Then you'll be much better at identifying what other people need. Does that make sense? Yeah. Fix your fault line. Fix your imbalance. Fix your weakness. Scientifically, quickly. Strengthen the muscles by two components. How?
Load speed.
Load and speed. Load and speed. So pick a movement that works those muscles and maximize the load and speed. Challenge yourself. Make sense?
Yeah.